Imagine, just for a second, that you are handed 42 billion pounds.
Oh, wow. Okay.
Right. And you are told that you have just a few days, literally days, to buy enough life-saving equipment for an entire nation.
That is, I mean, that's just an unimaginable amount of pressure.
Exactly. But here's the catch. The whole world is trying to buy that exact same equipment at the exact same time. And to make matters even worse, you open up your country's emergency playbook and you realize the plans are completely untested and the cupboards are, well, they're practically bare.
Yeah, it is the ultimate nightmare scenario for any government. You're suddenly competing in this frantic global auction where the stakes are literal survival, and you're basically starting the race with your shoelaces tied together.
Yeah, starting at a huge disadvantage. And that staggering reality is it's what we're looking at today. For this deep dive, we are pulling from a Sky News report that breaks down the findings of the UK COVID-19 inquiry. Specifically, we're focusing on Baroness Hallett's Module 5 report.
Right, which is a really significant milestone because this actually marks the halfway point of the entire inquiry, which it's slated to be completely finished by next year.
So Module 5, it zeroes in on one crucial, deeply controversial word, which is procurement.
Yeah, procurement. How did the government actually buy the things it needed to survive?
Because we're talking about the physical objects of the pandemic, right? Like personal protective equipment, ventilators, testing supplies.
Exactly. When a country's borders close and global trade just completely seizes up, the mechanics of how you secure those items, it basically becomes the mechanics of how you save lives.
And so our mission today is to figure out how a government manages an unprecedented global emergency like this. We're going to explore the massive, devastating costs of being unprepared, the highly debated VIP lane that everyone was talking about, and most importantly, the blueprint this report lays out for the next crisis.
Because there will definitely be a next crisis.
Right. And to really wrap our heads around this, just think about your own taxes for a second. We are talking about 42 billion pounds of public money spent between January 2020 and June 2022 by the UK government and, the regional governments in Scotland, Wales, and Northern Ireland.
The scale of that expenditure is just, it's unprecedented. And what Baroness Hallett's report reveals is how rapidly a system can just buckle under that kind of weight. Because the UK entered the pandemic with its emergency stockpile in what the inquiry calls a perilous state.
Perilous state. That's a strong phrase for an official report.
It really is.
Yeah.
Because it wasn't just that the stockpile was small. The plans governing it were completely untested for a respiratory pathogen on this scale.
Right.
And shockingly, large quantities of the equipment they actually did have in warehouses that had already expired.
Wait, really? It was just sitting there expired. I always used to think of a national stockpile as like a giant dusty warehouse that just sits there untouched until an emergency.
Yeah.
But that's not how medical supplies work, is it?
Not at all, no. A stockpile is a living, breathing logistical operation. I mean, medical equipment degrades over time. The elastic straps on face masks perish. The adhesive on surgical gowns breaks down.
Right, of course. Plastic and rubber don't last forever.
Exactly. So if you aren't constantly rotating that stock, moving older items into the regular healthcare system and replenishing the warehouse with new items, your stockpile eventually just becomes a museum of useless plastic.
Wow.
And that's essentially what happened. The administrative protocols for rotating and updating the supplies had simply been neglected.
So it's not just like having an empty fire extinguisher in your kitchen. It's realizing your fire extinguisher is empty, and when you try to buy a new one, you discover that every single country in the world relies on the exact same factory in China for the chemical foam.
Yeah.
And that factory just shut its doors.
That is exactly it. The entire global safety net wasn't just empty, it was single-threaded. And that single point of failure is absolutely crucial to understanding the panic that followed. Because the UK was so ill-prepared domestically, when international demand skyrocketed, they were just thrown into this bare-knuckle global brawl for supplies.
Yeah, it's fighting everyone else for whatever was left.
Right. They had to improvise an emergency procurement and distribution system out of thin air in a matter of days. Normal vetting procedures just completely went out the window.
And the financial waste of that scramble is just monumental. I mean, out of the approximately 15 billion pounds spent specifically on PPE, nearly 2/3 of it was wasted.
Yeah, that number is staggering.
Almost 10 billion pounds evaporated on stock that was simply unfit for purpose.
And we really need to look at the mechanics of that waste, because 10 billion pounds doesn't just disappear into thin air. In a panic, procurement officers were buying anything they could get their hands on. But medical equipment has highly specific tolerances.
Right. It's not like buying standard T-shirts.
Exactly. If you buy millions of masks, but they don't have the correct fluid resistance, or they don't form a proper seal around the face, a hospital cannot legally or safely use them.
Oh, man. So what did they do with them?
Well, the government spent billions acquiring mountains of equipment that had to be burned, thrown away, or kept in storage at even more taxpayer expense simply because it failed basic medical standards.
It's hard to fathom. And while those billions were being wasted on unusable gear, the people actually fighting the virus were left entirely exposed. The report brings up these harrowing images that are probably, burned into all of our memories from that time.
Yeah.
Frontline nurses forced to wear black bin liners, and care workers literally wrapping themselves in plastic bags just to try and create some sort of physical barrier against a deadly respiratory virus.
Right, and that stockpile failure translated directly to human suffering on the ground. It wasn't just an abstract spreadsheet error in Whitehall. The source material highlights the story of Christina Fulop, and this is a narrative shared directly by her family.
Yeah, this story really stood out.
It's heartbreaking. Christina was an elderly, housebound woman, and during the second wave, she was completely reliant on in-home visiting nurses to survive.
And the reality for those visiting nurses is it's really hard to fathom. Because they were going from one frail, vulnerable person's home to another, and they were expected to do an entire 8-hour shift wearing just one single thin blue medical mask.
Yeah, a mask that is designed to be worn for a short medical procedure and then discarded was being stretched across an entire workday across multiple high-risk environments.
And tragically, Christina contracted COVID-19 and later died in the hospital. And her family made a very deliberate point in their statement. They said they do not blame the care workers.
Right.
Those workers were being asked to hold the line for the entire country without being given the basic tools to protect themselves, their own families, or the vulnerable patients they were looking after.
And it really grounds that 42 billion pound figure in visceral reality, an unprotected worker, an exposed patient, a lost life. And that desperate shortage is the critical context for the most contentious part of this entire inquiry.
The VIP lane.
Exactly. Because the traditional procurement systems were way too slow and the stockpile was empty, officials were basically drowning in offers from companies claiming they could source PPE.
Which brings us to the high priority lane, or as everyone came to know it, the VIP lane.
Yeah.
Because they had to act fast, the government improvised a triage system.
Right, because normal public procurement takes months. It involves open tenders, rigorous financial health checks on the companies, strict quality assurance, all of that.
None of which you have time for when hospitals are running out of gear by Tuesday.
Exactly. So in March 2020, officials set up an email inbox to receive offers of help, and it was instantly flooded with tens of thousands of emails.
Just a complete deluge.
To manage the backlog, ministers and officials started flagging offers from people they knew. If a lead came through a government connection, it was routed into this VIP lane for faster processing.
Okay, so we have two very different perspectives on this in the source material, and it's really important we lay them both out clearly here. Let's start with the official findings from Baroness Hallett. She does not pull her punches.
No, she doesn't.
She calls the VIP lane a, quote, misguided attempt at prioritization, and states unequivocally that it embedded unfairness into the emergency procurement process.
Yeah, and she goes on to say it should never have been set up and must never be repeated. Because when you abandon open competition and rely on personal networks, you lose your primary filter for competence.
Right.
You end up giving massive contracts to companies with absolutely no history of producing medical supplies simply because someone had the CEO's phone number.
But, and this is key, the inquiry's report explicitly states that it does not identify cronyism or corruption on the part of ministers and officials. Hallett's legal conclusion is that they simply got it wrong. It was a structural failure born out of immense pressure, a botched attempt to manage a flooded inbox, rather than a malicious, coordinated scheme to enrich their friends.
Right, and that is the strict legalistic finding of the inquiry. We have to be clear about that. However, the statement from Christina Fulop's family, which really represents the view of many who lost loved ones, offers a starkly different interpretation.
Yeah, completely different. The family's statement calls the VIP lane a deliberate and shameful choice. They describe it as and I'm quoting here, a textbook case of corruption and cronyism.
Yeah.
From their perspective, while ordinary people were risking their lives in those thin blue masks we talked about, a privileged few looked at a global catastrophe and saw a money-making opportunity.
Right. They view the VIP lane as this hidden route that gave those with the right contacts access to billions of pounds of public money with little to no oversight.
So you have these two realities existing side by side. The inquiry points to severe systemic incompetence driven by panic. But the victims' families see outright corruption where connected individuals profited while lives were lost.
Exactly. And the report highlights cases currently under investigation that illustrate why this anger is so profound, specifically mentioning PPE MedPro Limited.
MedPro is a massive focal point here. This is a firm linked to Tory peer Baroness Michelle Moan and her husband Doug Barrowman. They secured enormous contracts through the VIP lane, and they have now been ordered to repay £122 million plus interest to the government for providing faulty PPE at the height of the pandemic.
But we should note, according to the sources, Moan and Barrowman completely deny any wrongdoing.
Right.
And the inquiry is actually holding back its full, detailed findings on the MedPro contract award process specifically. They're waiting for an ongoing criminal investigation to conclude so they don't prejudice any legal proceedings. But the very existence of a £122 million dispute over faulty equipment procured through a VIP lane, it really highlights how deeply compromised the system became.
Yeah, it does. But let me push back on this for a second, just playing devil's advocate. Put yourself in the shoes of a government minister in March 2020. The regular supply chains are dead. Hospitals are literally hours away from running out of gowns. If someone in your phone contact says, hey, I can secure 1 million masks from a factory overseas by Tuesday, don't you take that call?
Yeah, it's a fair question.
I mean, in the middle of a total systemic collapse, isn't bypassing the red tape and calling your network just the messy, chaotic reality of trying to save lives?
Yeah. Well, the inquiry actually grapples directly with that exact tension. Baroness Hallett acknowledges the unprecedented pressure officials were under. But her conclusion is that relying on private networks to allocate billions in public funds fundamentally breaks the social contract.
How so?
Because when you bypass transparency, even with the intention of saving time, you cast a shadow of suspicion over the entire operation.
I see. It taints the whole well.
Precisely. Hallett notes that there were thousands of civil servants working around the clock, making enormous, well-intentioned efforts to secure supplies. But because this VIP lane existed alongside them, it undermined all of that hard work.
Right. It makes everyone suspicious of the whole thing.
Exactly. It shattered the public's trust in how their money was being spent during a time of extreme national vulnerability.
Yeah.
Fairness and transparency aren't just bureaucratic red tape. They are the bedrock of public compliance and trust during an emergency.
You know, you'd think that after uncovering a £10 billion waste and the deeply damaging chaos of the VIP lane, the inquiry would demand the government tighten its purse strings forever. But Baroness Hallett's conclusion on what the government should have done when faced with this crisis, it actually caught me entirely off guard.
It is arguably the most surprising pivot in the report. The inquiry defines the situation decision-makers faced as an unenviable choice. They basically had two options.
Okay.
Option A, slow down, enforce proper checks, rigorously vet every supplier, protect the public purse from waste, but accept that you will lose bidding wars to other countries and leave frontline workers completely unprotected for months.
Or option B, put massive sums of public money at extreme risk to buy equipment at the speed and scale the pandemic demanded, fully knowing, like going in with eyes open, that a significant portion of that money would be wasted on faulty goods and bad contracts.
Right. And they chose option B. They took the risk, they overpaid, and they bought everything they could. And Baroness Hallett concludes that, given the sheer scale of the emergency, choosing option B was actually the correct decision.
Wait, really? The inquiry says the waste was the right call?
Yes, because to have done otherwise, to have slowed down just to save money, would have placed health and social care workers and the wider public in unacceptable danger.
It's a complete inversion of how we usually think about taxpayer money.
Yeah.
You're suddenly paying a massive premium just to buy time, because time is the one commodity you can't stockpile.
Exactly. In emergency economics, the rules fundamentally change. During peacetime, money is your primary constraint. During a global catastrophe, time replaces money as your most valuable currency.
That makes total sense.
You're no longer just buying a ventilator, you are buying the ability to have that ventilator tomorrow instead of next month. And speed requires chartering private planes, paying exorbitant spot market prices, accepting massive failure rates. Speed is inherently, unavoidably wasteful.
And because they made that unenviable choice to move fast, the report does highlight some real silver linings here. It wasn't entirely a story of failure and waste. The inquiry specifically praises the domestic life sciences and advanced manufacturing sectors.
Yeah, that was a huge bright spot.
When the international markets closed, these domestic businesses stepped up in a major way.
We saw an incredible pivot. Companies that manufactured car parts or aerospace components completely retooled their assembly lines overnight to design and produce PPE, ventilators, testing equipment right there in the UK.
And we have to talk about the Army. The report singles out the military for stepping in and providing extraordinary crisis response. When the civilian distribution networks completely collapsed under the sheer volume of material moving around the country, the Army stepped in to organize the logistics.
Which is what they do best. Civilian supply chains are optimized for efficiency and low cost, which, makes them very fragile. The military supply chains are optimized for resilience and operating under chaotic, degraded conditions.
Right.
That collaboration, the public sector identifying the need, private manufacturers building the equipment, and the military executing the logistics that is held up by the inquiry as a highly effective blueprint.
But the underlying message of the report is a stark warning. We got incredibly lucky that the Army and private businesses could pivot so quickly. We survived through sheer improvisation, and we absolutely cannot rely on that next time.
No, we definitely can't.
We can't just cross our fingers and hope the military can fix our broken supply chains during the next novel virus. So how do we actually rebuild the system so we aren't improvising in the dark?
Well, that brings us to the core of Module 5's conclusion. The inquiry lays out 11 specific recommendations to ensure the UK is never caught flat-footed like this again. They identified two massive structural vulnerabilities. First, the UK's international supply chains were dangerously concentrated. They were far too reliant on a single country, China, for the raw materials and manufacturing of medical supplies.
Right, because if that one trade route goes down, the whole system just freezes.
Exactly. The second major vulnerability was their data and technology systems, which were shockingly outdated. Procurement, which is the buying of equipment, and distribution, which is getting it to the hospitals, they were completely disconnected from each other.
Imagine trying to run a £42 billion national emergency off disconnected Excel spreadsheets. I mean, you could have a warehouse in London sitting on millions of surgical gloves and a hospital in Manchester running entirely out of them, and nobody could see each other's screens to connect the dots.
And that lack of visibility is why so much money was wasted. If you don't know what you have, you just keep buying more to be safe.
Right.
To fix this, Baroness Hallett has set a strict 3-year deadline for the government to fully digitalize its procurement and distribution networks. She demands real-time data collection. Data has to drive the crisis response. You need a centralized dashboard where decision-makers can see the exact inventory of every hospital and care home in the country at a glance.
But beyond just updating the IT systems, the report demands a fundamental psychological shift in how the government views this equipment. One of the primary recommendations is that key healthcare equipment must now be regarded as a, quote, strategic national asset.
The terminology there is profound.
It really is. I mean, we usually reserve the phrase strategic national asset for things like military fighter jets, the electrical grid, or, nuclear power plants, things that are so critical to national survival that the government heavily subsidizes them and protects them from foreign control. This report is saying that a simple thin blue medical mask or a plastic face shield needs to be treated with that exact same level of national security importance.
Because without those simple items, as we witnessed, the entire healthcare system collapses and the national economy just grinds to a halt. Treating PPE as a strategic asset changes the entire calculus of how you acquire it. You no longer just buy the cheapest option from an overseas factory to save a few pennies.
Because cheap is dangerous if you can't guarantee delivery.
Precisely. It means you have to invest in domestic industrial resilience. The report calls for the UK to create an environment that actively encourages the research, development, and advanced manufacturing of healthcare equipment at home. It might cost more to produce a mask in the UK than overseas during peacetime, but that extra cost is effectively an insurance premium.
And for the things you still have to import, the report recommends building new, diverse trading alliances. You spread the risk around so you aren't completely dependent on one nation if borders suddenly close again.
Baroness Hallett is very clear here. These recommendations are a necessary investment. They are the price of ensuring that next time the public can be confident their money is being spent wisely, fairly, and that the equipment actually gets to the people who need it exactly when they need it.
We've traced an incredible arc today. We started with a completely empty, expired stockpile We moved through a chaotic 42 billion pound scramble that wasted billions on unusable gear and really fractured public trust with the VIP lane. We saw the sheer grit of the military and domestic manufacturers who bailed the system out. And now, we have a clear 11-step blueprint to make sure a catastrophe of this logistical magnitude never happens again.
You know, for anyone listening, this deep dive really exposes something we all tend to take for granted. We live in a modern world supported entirely by invisible supply chains. They deliver everything from the groceries on your shelf to the medical care you rely on. This report proves just how incredibly fragile those invisible chains are.
Yeah.
More importantly, it shows that trusting your government to manage those chains, to spend taxpayer money fairly and effectively during a disaster, it isn't just a political talking point. It is the absolute bedrock of public confidence and public safety.
It really changes how you look at the complex systems running quietly in the background of our lives. Which leaves us with a final thought to chew on. If the pandemic proved that something as simple and frankly as mundane as a plastic face shield must now be treated as a strategic national asset, what other everyday items sitting in your home right now might suddenly become a matter of vital national security in the next unprecedented global crisis?
That's a fascinating question to consider.
Definitely something to keep in mind the next time you open your cupboards. Thank you for joining us for this deep dive. Stay curious, keep asking questions, and we'll catch you next time.